Okay, so my name is Manda Harmon, and today I'm going to be presenting on community ethics and some considerations for research with equity-seeking groups. So I just want to acknowledge that I live on the territories of the unceded traditional territories of the Coast Salish people, including the Musqueam, the Squamish, and the Tsleil-Waututh nations. And I'd also like to acknowledge that our project took place on these territories. So just to give some information about myself, I'm a cisgender heterosexual woman of mixed Irish American and African American descent. These are some photos of my family. I'm generally racialized as white, and I'm a healthcare worker who's worked on the downtown east side for the last 12 years. And so the practicum that I was involved in was a knowledge translation project, and we were looking at educating frontline healthcare staff on equity-oriented approaches in healthcare. The first phase of our project was really looking at feelings of safety for vulnerable women who were accessing healthcare on Vancouver's downtown east side. We used the unique kind of spelling of women just to try and denote inclusiveness and to highlight the diversity of women who were accessing our clinics. This has included Indigenous women, women who use drugs, sex workers, as well as transgender and cisgender women. And so in terms of looking at feelings of safety, we did a photo voice project that was a qualitative community-based participatory project. And it involved providing cameras to women to document their experiences of safety when accessing healthcare. Oops, sorry, I went too far. So the concept of safety is a concept that emerged in about the 1980s in New Zealand. It originated with indigenous populations who were finding that healthcare environments were unsafe. And certainly within Canada, there's been a lot of recognition of the need for healthcare environments to become safer for Indigenous people. It's been acknowledged in the calls to action that were created by the Truth and Reconciliation Commission, as well as the First Nations Health Authority. In 2015, they actually asked all of the CEOs of these health authorities to sign declarations of commitment to cultural safety and humility. So cultural safety results from relationships of respect and attitudes of humility, predominantly for healthcare providers, that then create environments free of racism and discrimination, and create environments where people can feel safe when accessing healthcare services. So other equity-seeking groups, including the women who access our clinics, so women, cis and transgender women, racialized minority women, women who use substances, as well as sex workers have also identified the need to feel safe when accessing healthcare services. And oftentimes these groups experience a lack of safety due to stigma and marginalization that are related to colonialism and racism, norms regarding gender and sexuality, perspectives of racial and cultural superiority, as well as discrimination related to substance use and sex work. So while for my practicum, I was focusing on issues of safety with regards to healthcare access for marginalized women, for my culminating report, I was focusing on safety within research. So similar to healthcare environments, stigma, marginalization, and discrimination for equity-seeking groups, or because of stigma, marginalization, and discrimination, equity-seeking groups have also experienced feeling unsafe within research. Some examples of this include a lack of oversight regarding the activities of researchers, that some groups are further stigmatized by research, that oftentimes the goals of the researcher are prioritized over the needs of the community. And the example that I wanted to discuss was some researchers in 2019, Boylevan and a group of researchers reviewed studies from 2016. They found 60 research articles that were published on the downtown east side. Of these articles, 30% were made widely available to the public. The other 70% were only available through academic journals. So this example really points to the fact that researchers often prioritize their own needs over those of the community because they generally weren't making their findings accessible to communities in ways that were relevant to those communities. So based on these types of circumstances, different equity-seeking groups, in an effort to create safety within research, have created their own community ethics frameworks. And so our research question was, how do community ethics frameworks address the issue of safety in research for equity-seeking groups, such as the community of women living on Vancouver's downtown east side? Our methodology was doing a thematic analysis of 6 community ethics frameworks in Canada that have been created over the last 20 years. And we focused on frameworks that were inclusive of the identities and experiences of the diversity of women who were attending our women's clinics. So these are the ethics frameworks that we looked at. So in 2002, I'm just going to use this pointer thing. In 2002, the Ontario Public Health Association created the Ethical Research and Evidence-Based Practice for Lesbians and Gay Men. In 2007, the Kanawaki School Diabetes Prevention Project created a code of ethics research. In 2010, the Principles of Ethical Métis Research was created. In 2014, HIV community-based research ethics was created by HIV researchers and their advocates. And in 2019, the Research 101 manifesto was created for research on Vancouver's downtown east side, and also the Canadian Professional Association for Transgender Health created the ethical guidelines for research involving transgender people and communities. So from the frameworks, there were some key findings. One of the main ones was that community participation really needs to occur at all stages of research, ideally, because it matters who sets research priorities and determines what research questions are being asked. And that there needs to be a process for community consent, because research really needs to be relevant and beneficial for the communities. And finally, that communities should be involved in the analysis and the interpretation of data to ensure that communities are not misrepresented or further stigmatized. So I also just wanted to apply some of the key findings in relation to the project that I was working on. So issues of colonial and racism have influenced which knowledge systems are valued, and generally biomedical knowledge has been prioritized. And there was a real recognition that there needs to be a shift in research in terms of being influenced and informed by Indigenous methodologies. And so we were very much influenced by some of the creative approach to knowledge creation that exist within Indigenous methodologies, which is why we decided to use photo voice as a means for women to represent their experiences. The second finding that I wanted to highlight was that researchers need to be aware of the traumas that that may have been experienced by marginalized communities. And so just in terms of our project team, many of us have been working on the downtown east side for quite some time. Many of us are aware of the potential for people to have experienced trauma. And we really tried to approach relationships with humility and respect. And then the final kind of finding that I wanted to discuss in an applied way was the issue of compensation. Fair compensation is really essential because it's through this that community members are really being honored and recognized for the knowledge that they bring. So for our project, peers and participants were fairly paid. Oh, and I'm just getting a note from Nigel that I'm over. So I just want to just say one concluding remark. So just that research is not immune to some of the deeply embedded systems of power and oppression that exist within our society, and that it's very much influenced by racist policies, such as the Indian Act, as well as laws that have criminalized and stigmatized identities, sexual preferences, sex work, and substance use. And then I'd just like to acknowledge my practicum supervisor, Karina. I'd like to acknowledge Nigel for his support throughout my practicum, and members of our peer advisory committee who graciously shared their experiences and perspectives, and Vancouver Coastal Health, who hosted me as an MPH student. Thank you, everybody.
That's great, Manda. That really, really interesting topic, and I'm sure there can hopefully there are going to be some questions here. Anyone like to ask Manda a question? While people are putting their thoughts together, I'll ask you one. I'd be interested in actually hearing about how receptive you felt researchers have been or are to this type of work and these sort of issues that you've raised. Do you sort of see a growing receptiveness of, by researchers?
I mean, I think there's certainly a shift that's happening. Yeah, and I do think kind of, you know, research within Indigenous communities is really leading the way. I think, yeah, I mean, as many of you have heard, like in terms of the OCAP principles, and just those ideas of making sure that Indigenous communities have ownership and control over kind of research studies and research results. I think, you know, I think there's a shift happening. You know, it's one of those things I think that happens slowly.
Yes. There's a question from Jeff. So did you want to ask a question, Jeff? Turn on your microphone. Hi, Jeff. We can hear you.
Oh, can you? Hey, it's Jeff. Can you hear me?
Yes.
We can hear you, Jeff.
Oh, great. Great. Hi, Manda. First off, congratulations. You've done a great job on this. Congratulations getting here with me finally. Took us a while. I just have, and this is just such important work we need. There's so much work to be done on this. But I just had a quick question about the peer compensation. Really glad that that was included here. Did you come across anything in the ethical, like the frameworks around how to set that and like kind of a benchmark to set, like, you know, how you compensate peers? Because I think I've come across studies where, you know, they say there's fair compensation and they get paid, you know, a $10 gift card for 2 hours of time. So I just wondering if you came anything across anything that kind of set some sort of benchmark. Thanks.
I mean, none of those frameworks really specified kind of amounts of money. I think one thing that definitely came up in the research that I was doing was just that, you know, we really need to consider what wages are we providing to like research assistants, right? So students that are coming, how are we compensating them? And really recognizing that peer researchers and other participants really needs to be fair, right? It needs to kind of be balanced, that they are donating their time, or they shouldn't, I mean, they're offering their time, and they're offering a lot of kind of vital information that comes from lived experience. And so just recognizing that technically it should be on par with other research assistants that are involved in the project. Does that answer your question?
I think he's off, but I'm
sure yeah, that's awesome. Thank you, Manda.